Today we're jumping into a really important topic, how Prader-Willi syndrome is treated. It's a complex genetic disorder, so we're going to break down all the key strategies that help support people and, really improve their quality of life.
I want you to imagine something for a second. What if you felt hungry all the time? I mean, a deep, intense hunger that just never, ever goes away. A feeling that literally dictates every thought you have, every action you take, every single moment of your day.
Well, for people with the rare genetic disorder, Prader-Willi syndrome, or PWS for short, this is their daily reality. And while that constant hunger is the core challenge, the condition's impact goes way beyond that. It affects everything from growth and mood to behavior. But here's the thing, managing it takes a lot more than just focusing on food. So let's open up the toolbox of strategies. We're going to look at everything. The medications, the therapies, and the absolutely critical lifestyle changes that all work together to help people with PWS lead healthier and much more fulfilling lives.
All right, let's dive in. First up in our toolbox are the medical tools, specifically medications. Now, it's super important to know these are all about managing the symptoms of PWS. We're not talking about a cure here, but about making daily life better.
Okay, one of the biggest and most common treatments is growth hormone therapy, or GH. It's usually started when kids are young, and the benefits are, well, they're huge. It helps improve height, build muscle mass, reduce body fat, all things that are just crucial for physical development and boosting energy levels. But it's not a magic bullet for everyone. It's given as a daily injection, and it's not a good fit for people with severe obesity or certain respiratory issues. That's why there's always a screening for things like sleep apnea beforehand. And, of course, like any treatment, there are potential side effects to watch out for, so close medical supervision is key. Another really key piece of the medical puzzle is sex hormone replacement. See, PWS often leads to low levels of these hormones, so for both guys and girls, this kind of therapy is a big deal. It's not just about managing puberty. It's also incredibly important for things like bone strength down the road.
So, what about that intense hunger we talked about? Well, right now, there's no drug that can completely get rid of it. But sometimes, doctors might use certain medications off-label, which just means they're using a drug for something other than its original approved purpose, to help manage appetite. And for behavioral stuff, like anxiety or big mood changes, other meds like antidepressants can sometimes help. But, and this is a big but, this stuff always requires a specialist to prescribe and monitor it.
Okay, so that's the medical side. Now, let's move to the next part of our toolbox. The skill-building tools. This is all about therapy, and it's where we shift from just managing symptoms to actively building a foundation of life skills. And what's so cool here is that it's a real team effort. It's not just one therapist doing one thing. You've got physical therapy for strength and coordination, occupational therapy for daily skills like getting dressed, speech therapy for communication, and behavioral therapy to help with routines and coping. They all work together tackling the challenges of PWS from every possible angle. And here's a perfect example of how practical this can be. Skin picking is a really common challenge in PWS. So behavioral therapy offers simple, hands-on strategies. Things like keeping hands busy with a fidget toy or even just covering the skin with clothing. It sounds simple, but these little things can make a massive difference. All right, this next part is maybe the most important of all. You can have all the best medical tools and therapies in the world, but they have to be built on a super strong foundation of daily habits. This is where lifestyle isn't just a strategy, it is the treatment. And what's the bedrock of that foundation? Structured nutrition. Creating absolute, predictable structure around food is, without a doubt, the single most important part of managing PWS. It's completely non-negotiable. And I want to be really clear here, this isn't about being restrictive just for the sake of it. It's about creating an environment that feels safe and predictable. Putting locks on the fridge or pantry, that might sound extreme, but it's not a punishment. It actually takes a huge weight off the person with PWS. It reduces so much anxiety because that constant battle over food is just gone. And that need for structure, it goes way beyond just food. Having consistent routines and making exercise a regular part of the day is just as vital. Again, it all comes back to that feeling of safety. When you know what's coming next, it reduces stress, which in turn can reduce behavioral outbursts. And exercise is a must. People with PWS have a slower metabolism, so staying active is absolutely critical for managing weight and overall health. Okay, so let's pull all these pieces together and talk about the long view. What's the outlook, and what kind of support is out there for families dealing with PWS? And here's the really great news. When you combine all these tools, it works. It's making a real, tangible difference. The outlook today is so much more hopeful than it used to be. People with PWS are living longer, fuller lives, all thanks to this kind of structured, comprehensive care. And the biggest takeaway I want you to have is this: no family has to go through this alone. There is a whole network of support out there. You've got organizations like the Prader-Willi Syndrome Association, support in schools, specialty doctors, and even residential programs for adults. There really is help available every step of the way. When you really think about it, managing PWS is an incredible lesson in what's possible. It really makes you ask, how can consistent structure and compassionate support unlock human potential? It shows us that with the right toolbox, with medicine, therapy, structure, and a whole lot of support, it is absolutely possible to navigate huge challenges and build a rich, fulfilling life.